Let's talk about using side rails on a hospital bed when a patient is in hospice care. I just had a comment on one of our videos, the one about how to change a patient's soiled brief, and the comment was, please use side rails, and it had an exclamation mark. In this particular video, we didn't use side rails because we didn't want to impede the view of the process we were teaching. However, the use of side rails is really an important point to talk about in patient safety and comfort. You must carefully assess whether it will be beneficial to the patient and not cause a safety hazard. Has the patient had changes in their cognition, their mental status, so they wouldn't understand what the rail would be used for? Has the patient had many falls prior to the question about side rails? Who's in attendance to the patient regularly? Are they in a home or a facility? So what are the positive uses of side rails? They're great to help a patient turn over and reposition themselves in bed, get comfortable. It helps to hold on to one as you're sitting up on the side of the bed. It can help as pushing yourself up to a standing position. Those are all really good things. It can even be a reminder for someone who's weak to call for assistance and wait when they're getting help to get out of bed. But it's really important to note that every facility in every state interprets the law in this different way sometimes. Even in our own city, some facilities allow side rails and some don't. They interpret the law differently. Many facilities are no longer allowing the use of side rails as they have interpreted them to be a safety issue. The patient might fall and climb over and get injured and fall. So please evaluate each patient for the value and safety of adding side rails to their hospital bed. And in the next video, we'll talk about things you can do when hospice side rails are not allowed. Join us at the Hospice Care Plan and our YouTube site, the Hospice Care Plan. Thanks for asking questions.